can we just hear your take on how much the UK spends on health and what the NHS has got right? It's government expenditure. So are there any lessons that, say, India or any other country can learn from the way the NHS has been run and constructed and how much spending is done on it?
You opened our session by talking about the NHS as a national religion. And there's a great sense in which it's a community enterprise in the UK. And that's not common across the world. Secondly, we spend about 8 to 9% of GDP on healthcare. Across Europe, it's more like 11%. If I look at the Nordic companies, France and Germany, Nordic countries, France and Germany, there's no optimal figure. The real question is, how do we get high quality healthcare at lowest possible cost? When I look at India, it's obvious that more money is going to need to be invested in healthcare. But how can you use the technological advantages of India, particularly in relation to data, to leapfrog over some of the more customary models that we have in the UK and in the Western world? To me, much of the future of healthcare is going to be about data. How we understand and profile the health of the population, how we use data and AI to develop new drugs, and how we digitize, for example, imaging and its interpretation. I think these things are going to hugely improve the quality of healthcare. India's got an opportunity without imagining that it needs to move to 10% of GDP, an opportunity to make significant change in what is already being done.
So Malcolm, I'm going to come to what India is doing, and the Prime Minister has just announced the National Digital Health Mission, and I want your perspectives on that. But earlier when you were talking about the NHS, when we were chatting earlier, you said a couple of the things that is really done right and which eventually the leaders did right was to build trust, was to have daily communication, to have scientists standing next to you, to really bridge that trust deficit that had built up between the population and the leaders. And also, it's not so much in terms of the sheer spend, the budget spend, but you'd spoken about something very interesting, which was the priority and the percentage of spending. So you mentioned that UK, the second highest government spend in the entire budget is on health. And I found that a very interesting statistic, more than the actual numbers. So I just wanted to put that out for our audience. But now coming to this thing that you just said about digitization, technology, intervention, Prime Minister Modi has just announced the National Digital Health Mission. Pilot projects are being rolled out. What do you think the shape of that mission should take? There is some concern about data privacy, the fact that India is a very plural country. There's great digital divides, there's communication divides, there's capacity divide. How will patients explain themselves? There are many remote areas where people find it very difficult to even explain their diseases. So there's all of that. And the question I'd like to put to you is that in 2011, the NHS wrapped up its digitization scheme because it was a failure and it was deemed the most expensive mistake in IT history, So how do you sort of correlate the two things?
Well, all of the features that you mentioned in relation to India are exacerbations of what also exists in the UK, the divide, population scattered and remote, etc. You refer to the experiments that led up into 2011, and yes, it was a disaster because it wasn't well procured. Procurement lies at the heart.
I couldn't hear you. You said it was a disaster because?
It was badly procured. Too many companies were trying to do it and competing with each other, and it was underfunded. And by the way, procurement has been a disaster in many countries through this pandemic. But let me come back to the digitization. You mentioned this question of trust, and it's absolutely critical. Every time we try to expand the use of patient data in the UK, the question of trust comes up. How can we trust our government with data? I think people are willing to trust the NHS and doctors with their personal data. And we need to break through some of the privacy barriers to ensure that data follows the patient in whatever care setting they find themselves. But what we need to be able to do is have much more transmissibility of data across the system so that we can deploy new data methods of diagnosis and therapies. but at the same time retain people's trust. And I think it's doable. I don't think this is rocket science, but I think the answer has to be it's the patient who controls the use of their data. You talk about, of course, the digital divide, and that's absolutely true, but look at the pace at which digital phones and smartphones have rolled out across India, and a pace that I think has astounded the rest of the world. These are not impossible things, they take time. And the pandemic, to me, has demonstrated the critical point about trust, which is that our populations don't necessarily trust our politicians. They do tend to trust our doctors, and they do tend to trust our senior scientists, and they've been the bridge between government and the people, certainly in Britain.